lower back pain, sciatica. We're just gonna talk about this all different variation in pain right now. So let's say some customer come in your office and he said, I have this pain all around this area, lumbar area. I can't go down. It's painful, and I asking all the time the question: is there any radiate somewhere, like a down your foot? You feel in your knee, or and when it's painful, when you get up, when you sit, when you walk, after walk, it's a big important questions to ask your customers. So if you just experience pain right in this lumbar area, it could be the disc problem, but most of the time it's like mechanical issue. So let's say your glutes is not working, your lower back is overwork, double work, because the glutes is not fire up and it's not working. Or one of the vertebrae is like let me get to my spine. As you can see, a lot of people, what they do, they try to stretch lower back and they do a lot of rotation. But if you see how this lumbar area it's designed for not move and do a lot of rotation. But people like that crack, like that pop. Why? Because this vertebra, it's kind of stuck up here and jammed, and when you turn, it's click. Yes, of course, and it's go right in this groove. The idea is to not crack and not mobilize this lumbar area. The lumbar area, it's for the stability. That's why every time you lift, you go up and down. This is the whole power come from here, from your hips and lumbar area. So don't try to twist this area. Upper body is perfect, and lumbar for stability. Now, if you have a disc problem, like you can see it right here, if you've been sitting for a long time, like lean one side to another, or you walk like this way, a lot of people driving the cars, or you probably driver, your legs is always forward. This is create this balance in your hip, and of course is go all the way up. Could be the ankle problem too. Every time I do massage, I start checking with the ankle. How's the ankle mobility? How's the person can sit down? We're gonna do this in a minute. So if the pain is going down the leg, one leg, it might be that disc. So this is the straight disc, and if you lean one side to another, the one side is starts smashing one side, like let's say clicking up here, and a gel coming out from other side. It's like a donuts, jelly donuts. If you every time you eat this donuts, a gel is coming out from the other side. Same happening with your spine. I'm not sure if you can see this red bulb up here, and it push on your nerve and it shoot all the way down. And guess what? It's a lot of map up there. I will get to post this. So it depends on what disc is being jammed. You feel all this different sensation in your legs. You can feel sensation in your quadriceps, you can feel in the hamstring, you can feel around your knee, and that's what all different disc can be damaged. All right, so this is the idea. And of course, if this person get car accident or some like a sport injury and they can't walk, they just barely walk in your gym, I highly recommend just work lightly on these people, not dig in there, and just referral to the doctor. Talk to the doctor, send to the surgeon, right? Not the surgeon, what's this? Not the osteopath, or orthopedic surgeon. So make sure they do MRI and you start working on these people, because if person like being like, I don't know, do some squat 450 pounds and he's get injured, he came right here and you try to help. Of course, I know that because I was there too. You can more seriously damage because you don't know what's going on. If they have spondylolisthesis, this disc has been pushing forward. Just think about it. If discs slide forward and you apply more pressure with your elbow, which the most people do, you're going to push more that disc, and this could be seriously damaged, right? It's really serious damage. If someone come to my office and I have spondylolisthesis, like whatever grade is, like a grade 2 or grade 3 AB, I'm probably gonna say, you know what, I'm referral to work on this area, because I don't really know. I don't see those pictures. I'm not a surgeon, and I don't know how bad I can damage this person. The idea is do not damage, right? So a couple of weeks ago, I've been damaged my lower back. So I'll try to lift some weights, and I will tell you what I did for a couple of weeks, a couple of days, not the weeks. Actually, I've been recovering 3 days. But so what we learned here, if this is tingling down the leg, it could be the nerve problem. It's going to be bulge or herniation. Also, SI joints cause a lot of pain in this area. A lot of people, what they do, they try to, bend forward, pick up the weights, the central shift of your body is shifted, put too much pressure. This thing is not lock it back, cause a lot of pain. And a lot of people come in, oh, I think I have a disc problem. We just work on SI joint, it's popped back, a couple days, they walk, and it's getting better. But make sure you don't lose that, you don't mobilize this whole area, okay? Your hip, the hip, yes, it have to be mobile, but not this area. A lot of people mobilize this, it's not good. So everything mobility. All right, so what I'm doing first, check with my client, you probably see on the phone, I see his postural assessment. So every time people come in, I just look in general how people looks like, how they standing, and I pay attention to the ankle. So you're going to see on this one, if anything, inversion, if the foot inside, I can see here. If I see the bunny toes, those bones growing on the side, they probably put too much pressure on that inside, the medial side of the foot, and it's grow that bunion. It's a lot of inflammation out there, and it's painful, nasty stuff. Next, what I'm doing here, I check the position of the hips and knee. So I found that the anterior PSOS, not the PSOS, ASIS, anterior sacroiliac bone, that groove right here. And what I'm doing, you see that bumpy stuff, and I'm just placed a little bit below, and that's what I'm doing. This is what the spot I am looking for. So I'm gonna find this on David. It's right in here, and now I drop it down, and I see the fingers. So what you guys see from there? You guys see it?
The left is lower.
The left is low. Now I'm gonna show my butt and reassess myself. Yes, the left is lower. So what could be here? It could be this side is rotated up a little bit. Could be this ilium is rotated forward, or could be just a lean. He's lean on the side. We have to check that. Now and check the knee and what's going on with the knee. Can you guys see it? Okay, I put it like this. I think it's the same problem, right? Okay, let me go this way. Here we go. Is that better?
So the left is lower.
So left and lower. But in the hips, what situation we have? Okay, find that, and drop it down. So the left one is higher, correct?
Yeah, left.
So left is higher here, but the knee is lower, right? So that's kind of, I think it's something with the iliums. Yeah, something with the ilium. And David, he have a history of that, the hip problem, right? Next one, I asked him to turn around. I found posterior sacroiliac bone. It's right on the back. It's all in our book. I place in that back. Go ahead and turn to the camera. So here we go. I found them, and you see, left one is higher, correct?
Yeah.
So left one is higher, and when he stand face to us, the left was lower, correct? So that's mean this one is tilted. This whole ilium is tilted forward. It could be restriction on the lower back, and also get this problem with the lower back. So sciatica could be happen, all that stuff.
The injury was on the right.
Yeah, the injury on the right. That's why.
Causes trouble on the left.
Correct. So compensation, body compensate all the time. Body very smart, and they don't want you to experience pain all the time. That's why we always do assessment. We're never chasing the pain. If someone come in and say, I got pain, and you just start doing that, it's not going to help person, because you have to assess what's going on. And problem may be on the right side, but you just treated the left side. It's maybe help with the symptoms, but never help with the problem he have. And I can see already when I'm touching here, I see this side is kind of pops up more. I'm going to undress you.
Yeah.
You can see this. You see how this muscle pops up, and that one. And also what I'm looking for, now look at this. You see this is like nothing up here. It's like really nice. And look at this skin. You see the skin is kind of a little bit squishy up here, right on that side. So that's mean he's kind of lean on that side, and also rotation. So he's rotated. You can also do this on the table. I will show you this variation, but this is what we pay attention. Next one, I'm hold this posterior sacroiliac bone. It's right here. Wow, it's a big difference. And I ask him to move, bend forward. And you see what's happening? This finger is go up, and this one is stay. So this side is very, like everything pulled. All this kinetic line, all this fascia is pulling this hip up. It have to be shifted back. If it's shifted back, it's nice. If not, it's pulling all that ilium up. So this is what's happening. He's pulling this up, and it's not good. Okay? Next one, what I'm do functional tests. Let's see if David can go with a nice squat. You can just turn this way. Okay, here we go. And I ask David to, the legs is not wider than your hips. And I ask him just hands right here in front of him, and go ahead, do squats as low as possible. And up. You can see his arms is coming up. Yes.
I'm good there.
Good. And up. He done. You see how slouchy he is? And look at that. It just pops right away. So, he's not bad in this one. Next one, got a head cut. Next one, it's a hip. I ask him to just raise one leg up and hold right here. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. It's perfect. He's not shaking a lot. Now switch. I mean, he's doing a lot of exercise. Here we go. Look at that. And what do you feel? This one is less. You more. It's harder. So it might be ankles, might be the hip. Okay. So this is, I always do those kind of tests. Yeah. Next one, you can do the hands reach the toes. What I'm looking for here, come back up. If any pain present, you stop. Foot together, his foot together. Yeah, feet together. Now he's leaning towards. And what I'm looking for if this is rounded. So you see how flat he's here? It's like a flat, like a table. I can put my beer and like, I don't know, enjoy my lunch. But here rounded and here flat. So come up. I believe it's a lot of like stuck in here. Okay, he don't have any tingling numbness, but this is what's going on. Go ahead, step on the side here. So this is most tests I do. What else we do? Do you remember from my book?
Yes, I do that. We do the thoracic. Oh, the head, the turning the head.
Yeah, this is. Yeah, we're talking about. Upper body. We This is the full body assessment, but now we just specifically talk about lower back. Yeah. Now we're gonna do a little bit. Correct. Yeah. This is we're gonna go next. You see, this is the 7 points of the assessment. We did assessment. Now we're gonna go to do range of motions, and we're gonna do for lower back. We're gonna do Faber test. We're gonna do straight leg raise, and the first one we're gonna do Thomas test. You're gonna sit tiny bit. The clients will sit just a tiny bit on the table. He's not like all the way in. Now I'm just help him. I just maybe lower back pain. I hold in the chest and ask him to lower down, help him out, bring the both legs up. He's holding both leg, and now I'm asking him to lower down his right leg. Try to keep it neutral. So look at that. Look how bad it is.
Bad.
Yeah, very bad. He is actually struggling here. He's not 120 degrees on this one. Have to be 120. And look how tight he's here in these quadriceps. Hip flexors. Let it go your head. He's trying to lean. Now look. It's very in the air. It's pulling up here. You guys don't see it on the camera. Now look at that. It have to be 90 degrees, but it's, you see how this come up? And it's also come to the side. So I will definitely want to work on the hip flexors and quadriceps. Switch, take another one and drop. Look at that. You see how this go on the side? Yeah, so he's definitely need to work with those bands. Come up very slowly.
That was gonna be good.
Oh, that's all right. That's all right. Now you're going to lay down face up. And this is our straight leg raise. And what I'm looking for here, if he can go 70 degrees. 70 is probably right in here. And if this passively I help, I have to be 80 degrees. So slowly raise up, neutralize. I would say, what do you think? It's a 70 and lower down again and up. It's a little bit limited. Let's see if I can help. Yes, I can help and it's go up there, but it's still limited. Go ahead, this one. Okay, don't bend. You see, he's bended. Well, I will.
There's room for improvement.
Yeah, it's room for improvements. It's not bad. Do you experience any back pain?
It's just tight in the hamstring.
Tight in the hamstring. A lot of people experience lower back pain during this test. So that's mean your disc is like start pushing on each other. So you need to definitely see a physical therapist, massage therapist, manual therapist, chiropractor to make this released. Do not make this happen. Every time you raise your legs, just think about it. It's a pain. Okay? So this is was the test. Now I also look at those leg, how he's laying down. A lot of people, they lay down like this. Right? So the legs is like open to the sides. I want to make sure it's not happening. Yes, next one, it's a Faber test. Faber test, yes, you're going to place this knee on the top of the left foot. And what I'm looking for, I'm just a little bit readjusted. He's good. He's not compensated. And what I'm looking for, this is huge distance. You see between the knee.
More than 2 fists.
Oh yeah, it's have to be 2 fists. It's probably like a 3 fists, and it's have to be his fist, not my fist, because we're different. So I just measure it. It's probably kind of like close, but
I want to do your fist.
yeah, my fist. Okay. So this is large, like big. What we can do? No, hold on. What I'm doing here, I'm brace his core. I ask him to raise the arms and push against me. Push, push. And let it go. So it's readjust the core. If sometimes it's tremendously drop, but I saw this maybe like 10 cases in my life. Now switch this one, and that one, it's better, but it's still a little bit limited. So E version of the hip, probably the problem. We're gonna get closer look. This is the next test. So guys, everything in our book, it's not that difficult, so easy to learn. Now we're going to bring this knee in 90 degrees, and what I'm doing, I'm do internal rotation of the hip. So our hip is going this way. The leg is coming out on the side, and it have to be 35 degrees, and it's probably 15. So you see it's not working. Now I check the ankle. Not bueno, nothing in here. Outside, same, nothing. So we have ankle problem, and we have it might be that caused the hip problem, and it's limited. Now, external rotation of the hip have to be 40. It's a little bit limited, but it's better than external rotation. Next one, we're gonna check this leg. Here we go. I'm just, for the purpose camera, I'm not going around, but usually I go around. And look at that, it's like a 5. See, we've been working on him, and he was good. He was almost 30. Now, nothing up here. Ankle, this one is actually going, and nothing going up here. You got it? So this is simple. Bring it in, in, out, ankle. There we go. So we have problem, definitely problem. Ankle mobility problem, and that's why everything is not good, not bueno. Okay, next test, I like to test the muscle testing, if any cause the pain, and hip flexors. I raise this leg 45, like maybe 30 degrees, and I ask him to resist me. So resist, and I push down. Let's see how strong he is. Yeah, pretty strong. Any pain? Good. Relax, let it go. What about this one? Raise, and I push down, you resist. Still strong, very good. No pain? No, yeah, this good, let it go. So, I don't see any muscle, like any cramps, any pain? Good sign. So we need to work on those hip mobility. Okay? You guys want to add something else? No? All right, that's great. So I hope you guys learned something new, how to check the hips. Always check the hips. Now, face up. Now we're going to go face down. Face down. And this is my favorite test. I learned this from Paul Kelly. If you guys know who Paul Kelly is, definitely visit his class. He's going to be here in San Diego this year. I will probably go if I don't have other plans. But I just put the shirt up and look at this. You guys see how different it is? Look how he pop up here and nothing up here. You see this? See this muscle? That's mean he's rotated, right? We can check that. How to check this? You always tuck those toes, the foot inside, right in here. So this is without any foam rollers, anything. Now you find those posterior sacroiliac bone, and you measure this way. I always do this on dominant side. So my dominant side is the right side. I always stay on my dominant side. And check with my dominant eye. If you don't know, check our book or check our channel. We talking about this. So you guys see this? He's this way. He turned this way. Now I can go by the spine. Let me get the camera. All right. Don't kick leg, please. We got the camera here behind you, David. So, the legs in the position, and you can see, I found this posterior sacroiliac bone, and this one is deeper. So this could be ilium drop this way, and the whole spine is rotate. That's what we need to correct it. And you can see the difference on those muscles. This is really pops up. What's it telling me? That's telling me he always stay with his left leg forward. That's why he got those rotation in the spine. The most people who start walking with the left do everything with the left. Why? Oh, a lot of people say my dominant leg is right, and I say throw something, and when they throw, they step on the left leg, right? So this has come from here. So the powers come from your left one. And I believe this is the left is dominant because this is where the power is. You can stay on this one. Right is not. It's a hip. The hip is mobile, and that's how you use it. Like maybe dominate hip, but not the leg. Leg is this one. So he's probably same as me. My pattern, they go cross pattern this way. It's Christina. All right. So this is what we done, and this is how I check the problem. And of course, we're going to start do correction.